I'll be talking on the lesson learned from the pilot program in Kebbi State. I have no conflict of interest. I wish I have one, but currently no financial conflict of interest. My I'll use these objectives to guide the presentation. I'll give a brief overview of the role of HPV vaccination in prevention of cervical cancer, and give a review of the immunization terrain in Nigeria, then give my experience on HPV vaccination program, then give our opinion on how program consideration for sustainable HPV vaccination program in Nigeria. Thank So Dr. Basi has given us overview of the terrain in Nigeria. So I will skip most of the discussion regarding Nigeria, the demographics in Nigeria. Just to say that the picture here is symbolic for me, because on it you have different mode of transportation, and as Dr. Basi rightly presented, we have challenges, and the whole aim is to overcome the challenges no matter what, so that even if it means you're riding bicycle or flying in aeroplane, the destination should be the target, and we should keep moving on. So just an overview of the role of HPV in cervical cancer prevention, in the cervical cancer, in cause of cervical cancer. We all know that it's established fact that HPV is necessary but not sufficient cause of cervical cancer. More than 90% of cases of cervical cancer are caused by high-risk HPV infection, persistent HPV infection. And because of the nature of cervical cancer itself, even before the advent of HPV vaccine, it's been said that cervical cancer is preventable. But with the advent of HPV vaccine in 2006, the hope of possibly eradicating cervical cancer became there. And subsequently, the developed countries have been able to use the knowledge and the technology, including vaccine, to reduce the burden of cervical cancer, while developing countries like Nigeria, as presented to us by Dr. Basi, we're still struggling with the high burden of the disease. And because of this unacceptable global inequality in the burden of cervical cancer, the DG of WHO made a call for global collaboration to eliminate cervical cancer, which led to the launching of the global strategy in 2020. And HPV vaccination, with the target of vaccinating 90% of the eligible girls, that is before the age of 15, is one of the pillars of the global strategy to eliminate cervical cancer. So, of course, Nigerian responded to that call, and so far we have a lot of increase in political will towards achieving that target. Dr. Zainab Bagudu, the wife of the executive governor of Kebbi State, where I practice, and Professor Isaac Adewale, my mentor, have been leading the political advocacy to that effect. So this, just to add to the background on the immunization terrain in Nigeria, I just have three messages from this slide. One is that we cannot talk about HPV or any immunization in low-resource country without talking about Gavi. I apologize for that blurriness in the pictures of that I got from the screen of the website of the Gavi. But unfortunately, it's like Nigeria is to be transiting from Gavi eligibility, but we can't. Dr. Zainab made a very lucid presentation in one of our publications, calling for review of that eligibility criteria used for accessing HPV vaccination. Even our routine immunization needs support. We are only about 58% coverage in the routine immunization. But despite that, we have success stories that we can learn from. The eradication process of smallpox, for example, the polio eradication, and of course the current COVID vaccination program. All these vaccination programs provide learning points that we can learn with to improve our HPV vaccination. Just to, this has been emphasized, the uniqueness of HPV vaccine, the fact that the target age group of HPV vaccination is different from the routine immunization, and that creates a challenge of delivery. So there are various delivery, the age, recommended age for HPV is between 9 to 26, and what the target for the global strategy to eliminate cervical cancer says 9 to 15. So these are the various delivery mode, and as Dr. Bassi said, Nigeria, we are looking at the fixed health facility and school-based program. So I just put this to talk about this I got from the costing, the costed plan for the cervical cancer prevention in Nigeria. And so it was a costed plan from 2017 to 2021. And that was before the launching of the global strategy. The target for the costed plan was supposed to be 78% vaccination of our girls. Summary is that over 5 years, Nigeria is hoping to spend 67,681,000 on HPV vaccination alone, and that this will give about 13 million per annum. And if you look at that against the global, the budget, the overall budget of Nigeria, which is about $1.3 billion, you see that it's almost impossible for Nigerian alone to be able to fund the HPV vaccination without support. So currently, as deposited by Dr. Bassi, there's no national HPV vaccination program ongoing in Nigeria. However, we had a pilot program from Kebbi State, which is the one I will really dwell on, and then it has been concluded. Then there was ongoing rotary vaccination of schoolgirls limited to Lagos State. Is still an ongoing thing, and we have a lot of on-demand for vaccination. Unfortunately, there is a vaccine shortage, as alluded to by Dr. Bassi, and this is creating even challenge for people that have their resources, that have money, that they want to access the vaccine, and they are not able to access it. And in terms of the Nigerian terrain, maybe while we are planning for the proper introduction of the vaccine, the program introduction, we can start looking at the strengthening the demand aspect of the demand delivery model, where patients or people that have their money can also access the vaccine. So in terms of Kebbi State project, the initial plan for the Kebbi State project was supposed to be at Zamfara State and Kebbi State, but unfortunately, we were not able to have it in Zamfara State because of some bureaucracy. And this goes to underscore the very strong importance of political goodwill. So because of the good political goodwill Our Excellency Dr. Zainab Bagodo enjoyed in the Kebbi State, it was able to still fly that program, while we were not able to fly it in the Zamfara State. Then, despite the proper planning for the program, at the time the program was supposed to be, at the point of vaccination, there were some challenges regarding initial refusal based on some misgiving from the traditional rulers, and that was easily tackled. So what the importance of that is that there's a need to involve the traditional and religious leaders at the beginning or at the planning stage. Otherwise, if you miss them out, particularly in the northern part of the country, if you miss them out in the planning stage, there's chances and tendency that they might create a stumbling block for proper implementation. What we observe is that the girls are willing to take the vaccines, However, they can easily be influenced by peer groups. So the Medicaid, the foundation of our excellency, already has school health programs in the school where the students have already been sensitized. So therefore, the peer pressure to negatively influence the students was not recorded. So there's a need for consideration of strengthening school health programs when we are planning to introduce HPV vaccine program in the country. Of course, the parents are willing. We also noted that the parents were willing to give consent, but their decision also can be influenced by traditional leaders and religious leaders, which is emphasizing the need to involve the traditional leaders. I also just want to also add that from the ongoing Rotary project, I was in the program where they were discussing some of their challenges, and I got to understand that even some parents were refusing consent to HPV vaccine because of the linkage of the HPV infection as a sexually transmitted disease. And therefore, they were thinking that if they give them the vaccine, meaning they are giving the girls license to be promiscuous. So they had to change their campaign message in terms of they have to change their campaign message to de-emphasize the sexually transmitted nature of HPV, so as not to generate stigmatization and anti-vaccine from the parents.
Thank you for wrapping up in 1 minute.
So in conclusion, there are enormous challenges for HPV immunization in Nigeria. However, the rewards to introduce the HPV is equally very great. So, but in the process of trying to introduce the HPV vaccination program, there's a need to look at the federating unit, the 36 states plus FCT, rather than making a decision at national level, because there are different prevailing cultural circumstances in each state that might be different. Just as you can see on this graph, on this picture here, this is this represents the 774 local government area in Nigeria, which is the 774 local governments in Nigeria, and each of them have their own unique characteristics that needs to be put into consideration when planning for HPV vaccine implementation. And also, of course, there are limited resources for unlimited development. So the goal will be to use the available resources for sustainable development. Thank you.